This meeting is being recorded.
Now technical challenges on the side. Hi everyone, I'm Irving Amukasa from Sophie Bot, and at Sophie Bot we use AI to answer your questions on sexual and reproductive health. I'll begin sharing my slides now. Yes, I just said AI and sexual and reproductive health in the same sentence. Yeah, hope I'm not. So let me share my tab. Okay, awesome. Okay, now figured out what was the problem. If I share my screen, it also shares my audio or something, and I can't like talk while I share audio. So if everything, can everyone see my slides?
I can just see the Zoom screen. I see Brio many times, but I can't see your slides. I think you're sharing the general screen.
Let's try that again. Okay, let's do this. So it's something I've never faced before. So I'm on Zoom on my browser tab, and once I start sharing my screen, it won't share. It stops sharing my audio.
Yeah, you can send me your slides if you want, and I can. Oh, now I can see your slides, but I do see that you're on mute, so I don't know if you can do both, or you can only do one or the other. You can send me your slides quickly if you like, and I can be your slide deck. I'll send you my Google.
Let me do that really fast. It's such a weird edge case to like start solving for now. Yeah, I'm sending it to you right now, and it's a browser thing. It's an absolutely new browser thing that I've never had to face before. So beauty of it is it's on Prezi, and I can share that really fast. While I'm sorting that, it's we've not started working on this problem today. We started working on this problem in 2016, and back then, the technology we had then was what we call rule-based bots, where you manually have to anticipate what the users was about to ask and then answer questions. We started off right in 2016. Facebook had just accepted bots on Facebook Messenger. So there's a whole arms race around people building around bots. And the approaches were to either to predefine, anticipate the user conversations beforehand, and then provide answers to them, or work on something called intent. So building technology around trying to infer intents from the user questions. A technology that didn't work as well for us. Thank you, Lizzie, lifesaver. Awesome. So next slide. And a huge problem we faced. Okay, next slide. We faced with predefined the technology we had at that time is that if a question was anticipated from the user, our technology would handle that really easily and really fast. But then if it's in a format we don't understand, if the syntax changed just a little bit, and something as simple as saying hi, humans can say hi in 500 plus different ways. That would break our system, and they would hit our default response like, let me think about it. Next slide. And our reviews showed that. Reviews show that. So it's absolutely terrible reviews. But the only lining to that cloud was that we grew a data set of questions. So should we work on technology that can automate conversations better? We had built out a data set of conversations. By 2017, there were about 30,000 question answer pairs organically from users, even though we're not good at answering them. And I started learning through there are two options: either dumb down our solution where we could go through a menu driven bot, press 1 for STIs, press 1 for press 2 for HIV, or we could work on that technology. And I kept on working on the technology. So from traditionally as an Android developer, I had to learn AI, ML tools, AML skills, and at the time, the most bleeding edge technology was LSTMs, long short-term memory networks, which didn't work for us. And I remember I was so naive at the time, telling myself that deep learning was overkill. We just needed to find a machine learning tool akin to what was working with for sentiment analysis. But something exciting happening. Next slide. In around 2017, the first paper describing attention mechanisms was released. So attention is all you need, and soon enough we had BAT. So the technology was promising. It was very excited for us that in simplistic terms, an encoding layer, a decoding layer, it can be used to understand sequential data. So an example, example there is text conversations. Question is, at which point can we start building on it? At the time, most literature, most advancement were being described through papers, and then you get into this entire problem of trying to recreate papers without the actual code. Like you've never described an encoder. Like you've never written code. Like you've never done you've never written an encoder. How do you start writing that from scratch? The more papers, the more state of the more papers got released in the space, the space got democratized to a level where we could get our hands on our own like transformer and train it for ourselves. So if you go to the next slide, next slide. So we actually found that transformer. So next slide. Yes. So we find our own transformer. We could train. Other so Lizzie, you're going. So previously bit. So what I want to focus on is the number of training parameters we're working with. It's about 9 million. State of the art papers were in the billions. So there was this arms race towards trading billions and billion parameter models, and every paper was a race towards that, while we figured out by just working with an encoder to understand the question. So input and target, that's defining just that into our model. We could train our own transformer with just our data set from Sophie Bot with interesting results. So just nine. The key thing there is like just from 9 million trainable parameters. The only thing we changed was the token length. So our token length was about 280. So 280 long to support like sort of our long form answers. We are able to get like interesting results. So go to the next slide. Yeah, next slide, easy. Yeah. We're about to spoil that specific slide. So in this case, somebody can ask the same question in a million different ways. So yes, the context is sexual health. Yes. And our transformer is able to synthesize just from 30,000 questions and provide answers for that. So it's really interesting, really excited. I think we appreciate is that larger language models, larger transformers are trying to kind of synthesize all of the world's available text so that it generates new novel answers. They're trying to solve AGI, like one model that knows everything, but then that is also has its shortfalls. Here we demonstrated for a specific use case in a specific domain with a small data set with small training parameters. That's 9 million. We could actually train a model and can generalize for your own unique niche context. Our data set also, because it was so organic from users, we have instances where people are asking us questions not in English. We have people who are trying to fly to the bot. So all those edge cases organically come from our users' questions from 2016 2017, and our model is able to generalize and provide answers for them. So, yeah, next slide. So whilst that was in English, and edge cases where if if questions are not supported in our use case, so trying to flood the board, asking somebody about something around out of sexual health, we solved that. Our model was able to generalize for that. We got a little bit of funding, and we were able to deploy a solution on SMS. But in Kenya, as a Kenyan solution, being on SMS and only supporting English doesn't have as much impact. So our next challenge was that could we then train the same model just by editing the training data, but just adding to the training data, can we now support multiple languages? We've demonstrated it can support edge cases outside our languages. We've had questions asked in Japanese, in Portuguese, in Russian, and it can handle like, oh, the developers haven't taught me that language. Can we now add, just by adding our data set with a new language, can now model perform better with that language? And next slide. And we started off with the data. So we just press next to zoom in on an area you want to focus. So yes, we have 30,000 questions. Previous slide, Lizzie. So we have a data set of 30,000 questions. I dare say in English, because sometimes you have those edge cases where it's not English, but then the answer redirects to English. How do we then translate those 30,000 questions to a new language and then now support a new language? Previously, I painstakingly like cleaned through the 30,000 questions by myself to do all that. But then we got lucky, we have a little bit of funding. We can work with a local CBO to translate our data set. So what you're seeing, that is a screenshot of an app I built from scratch for them, where we're working with CBOs with their own sexual health sexual health interventions, and with a network of peer mentors. So the peer mentors were actually getting this app, selecting a language, and then be fed a question and an answer in original language to translate in the new language. And we did that for Swahili from December to January this year. Next slide. Them translating wasn't just it. We had to like do some quality control, because some things don't directly translate in in context. So yeah, so it's some things context of queries didn't exactly translate, so you had to like clean through that, pick that up, and provide like appropriate context. Some things weren't translated exactly in context, and as you can see, like most of the structure of our data is question answer and question answer pair. So input target structure versus if you're doing fine-tuning now, where it's the question, the expected answer, and we provide context to kind of help the model generate an answer. So next slide, please. And we were successful. So people can now, like, just by taking the 30,000 questions that were in English, working with a CBU to translate every question and answer pair line by line to the new language, and some quality control, and then just retraining the model. Now our data set is now from 30,000 to 60,000, because it's now new to new languages. The model performs interestingly well. It performs well even when you mix languages. So we have questions where you just HIV, what is HIV? The answer is in English. HIV ni nini? That's ni nini is Swahili for what is. Like if you mix languages like that, the model is performant. It can pick that out and provide the answer in Swahili just by just adding your new data set. Our plan now is, and it's same like we added a couple of more steps per epoch in our training cycle, but then training parameters remain near the same by just doubling the data set. So it's about 9 million, 10 million trainable parameters, same to 80 token length to support long form answers, and the model performed well. Yeah, next slide. If I built something, yeah, so at least you can go to the next slide. So in conclusion, so don't believe me. So why before Sophie Bot was released, so that's the last slide. Before Sophie Bot was released, I had a talk where the same technology we were using for Sophie Bot, I trained it on a data set movie Q&A. So if you go to that link right now, you can find the same transformer we use for Sophie Bot, trained on movies with actual trained weights for on movies, and you can actually play around and deploy and play around with it and deploy it. It's more performant than trying to figure out ways to run llama on your on your PC. The one benefit that I forgot to mention is that so we own the entire pipeline with our AI tools. When you build smaller transformer, if you train smaller transformer with smaller data set with focused on the use case that you're trying to focus on, the model is lightweight. It's lightweight. It's lightweight, and it's easily deployable anywhere. There's a time we used to run it on the $5 dyno on Heroku. So all performance issues really are solved. What we haven't proved and what we don't have yet is the context. So the token length, so the context window. So we don't provide a long enough context window with small models, but then for our use case, it works perfectly fine. And you have use cases like this you can build on top of that. Yeah, I'd welcome any questions you have for me now. I should have checked the chat if the questions coming in. Thank you, Lizzie, lifesaver.
Thanks very much. No worries. I'm gonna stop sharing if that's okay, just so I can see everyone. But I can always pull the slides up again if people have questions about a specific slide. Yeah. Sorry, Brio. I only just saw your message. I did not go full screen. Yes. Does anybody have any questions? Otherwise, I have got one that I will start with. But feel free to raise your hand or put your question in the chat. I was just wondering, who are the kind of typical users of something like Sophie Bot? And are you also able to use the new data that you're collecting to kind of do continual pre-training, or are you kind of still toying with the model, or is it completely finished?
Yeah, so we are looking at 13 to 28-year-olds in urban Kenya. That's why we're only as an app supporting English as an Android app. But now we're on WhatsApp, now we're on SMS. We're trying when we support Swahili, we're also going for the rural demographic. So rural Kenya and targeting them in their local languages. So age group is 13 to 28. Yes, we still trick around with the model. There are a couple of weeks still training right now. A thing I forgot to say is that so early on, so before we got a little bit of funding, I used to train it on my PC, like on that smaller model, train it on my PC. It used to take me like about 4 weeks plus. 4 weeks plus. It's cuts now. We are training it on an EC2 instance. Those are the ML stacks on AWS, because we got a couple of credits from them. It takes a quarter of the time to get that. So the fast initial which you can play around with that turnaround is very fast, and we tweak around with it. Our last failed experiment was context, so we tried to like increase the context window, like even try to like increase some of the hyperparameters to see if we can train a longer model. But then with our data set, with the 30,000 questions, we're basically just overfitting it. So trying to train larger models for context, overfitting. But then we still tweak, but then we're tweaking less with the hyperparameters now and more with the data set. So the more insights you get, the more interesting and novel questions we get, we add into the data set and to train it. The most interesting one, which is outside our demographic, is we're getting questions on hormone therapy for menopause. So using hormone therapy as treatment for which is like outside of scope, but then so that happens. So just adding into the data set and retraining it.
Great, thank you. Does anybody else have a question they want to come with? Brio, go for it.
Hi, Irving. Thanks for the talk. This is really cool work. I think I missed it at the beginning. What's the training data? Like, how are these responses being like sourced?
We've been getting questions asked from 2016 that grew to 30,000 questions, and then I painstakingly cleaned through them. So it's organically from users when we're not as good at answering questions, and that's what we feed model. We'll feed onto the model. What I didn't give context was is the answers. So
Yeah.
I don't author answers myself. So yeah, in 2016 we got funded from the United Nations Population Fund, Kenya, UNFPA Kenya, and they have a peer mentor curriculum. So all our answers are basically lifted out from the UNFPA peer mentor curriculum. So on the question answer pair, the question side all sourced from users organically, and the answers that we link and what I call data cleaning then was matching them with answers right from the UNFPA peer mentor curriculum.
Great, thank you. I have another question, if I may, as well. Did you try, I don't know, I know there's kind of limited pre-trained transformer models. I know that there's quite a lot available on Hugging Face, but there's limited in different languages. Have you tried any existing pre-trained models, or are there any out there in the kind of more non-English languages that you're looking at? So
well, yes, but before we locked in on building our own model. So the state of the art then was multilingual BAT. So the old BAT. So this is way before ChatGPT. So it was multilingual BAT, but I never had a chance to play around with it. What we had a chance to play around with was GPT. So I have a notebook somewhere with terrible results from GPT itself, because I think I didn't want was whatever pre-trained model answers from all the model leaping and seeping into my data set, so into the answers I'm authoring. So that used to happen a lot, and it wasn't as performant as what we have now. So the last chance we had to play around with other people's larger models was the GPT models then, and I kind of noticed the use cases were different. People are looking at it for generating text, and then you put in your limits on how long you want the answer generated for. So with the last model we played around with was GPT, and at the time the most popular version then was multilingual. But what I see right now is people if you're not fine tuning on ChatGPT is a thing it's an overstatement, because you don't get actual weights. you go to your site, so the only actually the where people are moving forward right now is Llama. So Llama, we can actually get actual weights, and so people are running experiments on Llama, but then that's general purpose.
yeah, great, thank you. Does anybody else have any questions for Irving? I mean, I can keep going with questions. Yeah, I mean, I'm really interested in it. I've also been playing around with some transformer models recently, but I was wondering, how do you do you look at the answers that are generated, and is there any way to kind of score them on accuracy, or can users also give any feedback from the answers that they receive?
So problem is that we are constrained on platform. So on our own Android app, we control the pipeline. Yeah, we can. On our previous model, we had a tab where you can add feedback form. But then on other platform, we're constrained by the platforms you're on. So if you're on WhatsApp, you're building on top of WhatsApp, you can't add on top of that. What we do is we run a lot of focus groups. So before the Swahili version was out, we ran a focus group with guys from rural Kenya, and then got feedback from them on the answers. But then aside from that it's paranoid, being paranoid, and absolutely, because we don't keep track of the user, but we keep track of conversations. This year we're about 8,000 questions in, and it's every month. Getting paranoid into looking at the data. When I given the chance to speak, I was torn between choices. So talking about how we trained our own transformers, or talking about some of the ML tools we kind of use to try and get insights from questions. So and if I get to that, so my first slide ever, there's a word cloud there. So that was a topic modeling experiment that we tried. we tried, but that's just getting insights from questions. We also use some k-means to get the most popular question. So K-means it's K-means it's clustering. So some K-means algorithm. So if you look at the first slide, ever I should have started that. So that first screen ever, it's kind of like a topic modeling experiment. And then we're like, now let's put it on a word cloud. Let's put it on spark it on a word cloud. So we obsessively go through previous conversations for quality control. Yeah.
Yeah.
Welcome. Any more questions?
Thank you very much. Yeah. Any questions from anyone else? Feel free to unmute or pop it in the chat if you have questions. I think, I mean, I'll just kind of wrap up with another one if that's okay. And then, but where are you taking Sophie Bot? I guess kind of, are you expanding languages, or what are the next steps that you see in the future?
Yeah, so we are doubling down on trying to make Sophie Bot more accessible for people in rural Kenya. So there are about 47 local languages in local like dialects, so local indigenous languages in Kenya, and we've figured out a pipeline where we work with CBOs with sexual health intervention, and then adding on top of that, our next two languages will be Luo and Luya, because the CBO we worked with the English answers are the same CBO we'll be working with on the next two languages. So that's our entire approach. We've built a pipeline. We even built the app to help like translate our data set into new languages. That pipeline is built, so it'll be doubling down on that, working with CBUs, translating our data set into a new language, and then training a model for that. New language, and it being on SMS. So if you're speaking all the 47 like languages, like let me say like the next few languages, just talking to Sophie Bot directly on one main pipeline, you can talk to her in different languages because the model can now support that. So that's what next. If I go on a rant, so I was in a task force a couple of weeks ago, and also someone building for South Africa on top of ChatGPT, and they were recreating failures in two states. So they're getting a question in a native language in South Africa, translating it to Google via Google Translate, the Google Translate API, asking ChatGPT the question, then the ChatGPT provides an answer in English. They use the API to translate it back to the native language and providing an answer, which is it's 2 points of failure you're adding onto the platform. So, but the model knowing the language just from training, you have more impact, you have more control, you have more control on the quality. So that's the goal. The 47 local languages, we're working on the next 2 out of the 47 to support more local answers in local context. Now people can talk to us on SMS.
Thank you. Yeah, I mean, 47 languages, a huge number of languages. And I imagine there's maybe not kind of huge databases of text from those kind of languages as well. But really
absolutely none at all.
Yes, big problem with the language models, I think, in general. I was reading something about an interesting kind of I can't actually remember who funded it. It might have been the UN, but some sort of like collaborative of looking at different African languages, like from lots of different countries, and kind of trying to collect data on a lot of kind of smaller languages, or like languages where there's less written text, to try and fill the gap that's definitely coming for language models. But it's very interesting. But does anybody have any? Oh, sorry, go for it.
The biggest collaborative effort I see is Masahane NLP. I'll find the link and put it on the chat. So that's the Masahane NLP is the more is the biggest movement I see around this. I'll put that on the chart. Yeah.
Great, thank you. If no one else has kind of any last questions for Irving, I will say thank you very much to you. This has been recorded, and we will be sharing the recording with everyone afterwards. And I'll also send you a copy, but it will be up on the Dishy YouTube channel. and also in the Slack. Irving, you're very welcome to join us in our Slack channel if you're interested. Thank you so much for the link. I would definitely check that out. It sounds very interesting. And maybe we can also add it to like our resources at Data Science for Health Equity as well. But yes, I would say thank you very much for your time and for your talk. It was really interesting to hear about something very different from the work that I work on. Thanks very much for your time.
Okay. Yeah, thanks guys for having me. Thank you for all your questions here. I am Mukasa on all platforms. If you have any follow-up questions or feedback, yeah, I'm open to those. Yeah, really nice talking to you guys.
Thank you, Irving. Bye, everyone.
Thank you. Thanks, everyone.